नमस्कार दोस्तों, आई एम पूर्णिमा फ्रॉम फर्टिलिटी दोस्त एंड वेलकम टू आवर प्लेटफॉर्म। हम हमेशा आपसे बात करते हैं एक दोस्त की तरह, तो आज हमने सोचा क्यों ना हम और आप एक दोस्त की तरह मिलकर बात करें आईयूआई और आईवीएफ के बारे में। व्हेन वी यूजुअली स्टार्ट आवर जर्नी, इट्स अ टफ टाइम। हमें लगता है अब क्या होगा, इतना सब कुछ किया, नेचुरल कंसेप्शन में वी वर जस्ट ट्राइंग एंड ट्राइंग एंड ट्राइंग और इतने साल निकल गए। अब समझ नहीं आ रहा व्हाट नेक्स्ट, वेदर इट शुड बी आईयूआई और इट शुड बी आईवीएफ। फिर हमें लगता है इट्स अ राइट टाइम टू डिसाइड द डॉक्टर, रादर वी वुड से दैट राइट डॉक्टर। उस डॉक्टर को चूज करते हैं, ट्रीटमेंट आगे बढ़ता है। देन ऑल्सो फ्यू इफ्स एंड बट्स, फ्यू डाउट्स जो कहीं ना कहीं हमारे दिमाग में रहते हैं। क्या डॉक्टर सही ट्रीटमेंट दे रहा है? क्या आईयूआई इज द बेस्ट ऑप्शन फॉर मी, या मुझे अपना आईयूआई में कुछ साल या कुछ साइकिल्स आईयूआई नहीं करवाना चाहिए? आई शुड शिफ्ट डायरेक्टली टुवर्ड्स द आईवीएफ। ये बहुत छोटे सवाल हैं बट ये बहुत अहम सवाल है, क्योंकि इन्हीं सब सवालों पे आपका आगे का ट्रीटमेंट रहता है। और इन केस यू सिलेक्ट द राइट डॉक्टर एट राइट टाइम, देन नो डाउट पेरेंटहुड आपके पास है, आपके साथ है। सो आज हमने यही सोचा कि लेट्स टॉक अबाउट दिस एंड what to choose, IUI and IVF. I'm so sorry, I have this cough and cold, तो maybe मेरा sound थोड़ा सा अलग होगा, but I'll try to be as normal as I am. So let's talk about what to choose, IUI or IVF. And for this we just thought about डॉक्टर रश्मि अग्रवाल फ्रॉम नोवा आईवीएफ वाराणसी। जी हाँ, आप लोगों ने उनका नाम बहुत बार सुना होगा, जो लोगों ने ट्रीटमेंट लिया है या वाराणसी और उनके आसपास के जितने भी हमारे व्यूअर्स हैं। सो व्यूअर्स, लेट्स स्टार्ट द सेशन विद डॉक्टर रश्मि एंड प्लीज आप अपने सवाल, अपने डाउट्स प्लीज पोस्ट करना शुरू कर दीजिए, बिकॉज यस, आईयूआई और आईवीएफ बेशक छोटा सवाल है बट बहुत अहम सवाल है। सो लेट मी जस्ट add our guest doctor to the main screen and let's start with the session. Namaskar, Dr. Rashmi. Welcome to Fertility Dost.
Namaskar. Hello everyone. And I hope today we are having a very interactive session. बहुत fruitful हो. And I welcome all your questions, all your queries. You can answer any questions to me and get all your doubts clear.
Bilkul. And for our viewers, Dr. Rashmi is from Nova IVF Varanasi and she has been practicing for more than 5 years for this infertility treatment. एंड इंटरेस्टिंगली अगर हम कहें तो डॉक्टर रश्मि का एक्सपर्टाइज है इन आईयूआई, ईटी, एम्ब्रियो ट्रांसफर, एग रिट्रीवल, एंड सबसे अच्छी चीज जो मुझे लगी कि शी हैज हर एक्सपर्टाइज इन ट्यूबल पेटेंसी टेस्ट. सो डॉक्टर रश्मि, हम ड्यूरिंग द कॉन्वर्सेशन वी रियली वांट टू नो मोर अबाउट दिस ट्यूबल पेटेंसी टेस्ट, बट जस्ट टू स्टार्ट विद द कॉन्वर्सेशन, हाउ टू चूज आईयूआई और आईवीएफ, और ये दोनों का क्राइटेरिया, इट डिपेंड्स ऑन द एज और इट डिपेंड्स ऑन आवर मेडिकल कंसर्न्स आल्सो. सो ओवर टू यू डॉक्टर रश्मि.
Yes, to start with, first of all, I want to address that when should a couple, infertile couple, should approach a doctor? Because what I am noticing these days that many couples are coming to me after a very prolonged, after very prolonged period. Some are coming after 8 years of marriage, after 9 years of marriage. For the first time, they are meeting me and never consulted a fertility doctor before. So, first of all, let me clarify what is the definition of infertility and when should a couple living together should approach a doctor for consultation. So, if a woman is less than 35 years of age and she is living with her husband, having normal relationships for a period of 1 year, and she has not conceived yet, then I think this is the right time for her to visit a doctor, get her test done, and get a proper diagnosis and start the treatment soon. And if a woman is more than 35 years of age and she has planned her pregnancy since last 6 months only, and she has never tried before, like she's saying that I'm planning since last 6 months only, then also this is the appropriate time for her to visit a doctor, a fertility doctor, and get her test done. Because some people, they are getting too late for the test. So we do not want this in the present scenario. What we are seeing, that they come too late, like they are prolonging this period for 5 years, 10 years, and it gets too late for us to start any treatment. So any couple who is following this should get a test done for the fertility investigations. Now coming to IUI and IVF. First of all, let us know what is IUI. IUI is intrauterine insemination. And what is IVF? IVF is in vitro fertilization. So, what is the difference between IUI and IVF? IUI means intrauterine insemination. In this, what we do, along with the ovulation induction or in a natural cycle, we prepare the semen sample of the partner and we inseminate inside the uterus of a woman. So what happens, that we bypass many factors. Suppose a couple is having any sexual dysfunction, like there is any sexual erectile or ejaculation problem in a male, or in a women also there is any vaginismus, somehow they are not having regular intercourse. So in these cases, what IUI does, IUI bypasses many things. So directly the insemination is taking inside the uterus in IUI. It also bypasses many factors like cervical factors. If the cervical mucus or something is hostile to the semen, or it is not allowing the semen to enter the inside the uterus, so in these cases also we bypass these factors and we directly inseminate the sample inside the uterus. This is what is IUI. It also bypasses many factors like sexual dysfunction. If the couple is living far away from each other, they are meeting very infrequently, they are not timing their cycles. Some of the couples, they do not know the fertile window. When is a fertile window? When they have to be together, when they have to plan for the intercourse. So what we do, we plan the cycle accordingly and we educate the couples when they have to be together, when is the timing of the egg rupture, when should we do the insemination. So this is what IUI does. What IVF is absolutely different from IUI. In IUI, the fertilization is taking inside the uterus, inside the tubes. It's
Hmm.
like the natural fertilization only. It's not taking outside the uterus. What IVF does, in IVF, the fertilization is in vitro. It is outside the uterus. We are doing the fertilization in the labs, in the conditions which is similar to the uterine cavity. So
Right.
IVF is completely different from IUI. In IVF, it is the artificial fertilization. And in IUI, it's the natural fertilization. The gametes have to work naturally. But in IVF, what we are doing, we are extracting the gametes outside the body and we are making the fertilization outside the body. So this is the difference between IUI and IVF. Now, when a couple should go for IUI or IVF? This is the question. This is a very big question which many
Right.
couples are confused. Some couples say my doctor has advised me IUI. Some say that my doctors have advised me IVF, but they do not know why their doctors are advising them IUI or IVF. So many
Right.
couples are confused with this. So let me clarify that for IUI and IVF, there are specific indications. It's not like that any couple can go for IUI or any couple can go for IVF. Now, it starts with IUI. For IUI, what we want, there are four factors. See, if a couple comes to me, what I will see, what is the age of the woman, what are the kind of infertility, whether it's a primary or a secondary, means whether the woman has conceived before, whether she has delivered a child before, and it's secondary means that she has delivered a child before or she has an abortion before and now she is infertile. So
Input.
I have to see the age of the women, whether it's primary or secondary infertility. What is the duration of marriage? What is the duration of marriage, since how long they have been trying? What is the ovarian reserve of the patient? What is the semen count? How are the sperms? What is the motility of the sperms? Are they progressively motile or the progressive motility is very low? So all these factors will count for me to decide whether a couple should go for IVF directly or they should try for IUI before going for IVF. So these are the factors which make a personalized judgment for the patient. Like each patient has its own decisions. Like what are the factors present in that particular couple? I will count all the factors and then I will decide whether to go for IUI for that couple or directly go for
Right.
IVF. So
Right.
for a IUI to be successful, we should check. few things in a couple, because IUI is like natural fertilization only. Just we are facilitating, we are introducing the sperms directly inside the uterus. So for a IUI cycle to be initiated, we have to do a checklist. What is a checklist? We have to see certain factors in female also and certain factors in male also. In female, we have to first of all see the age. What is the age of the women, for how long she has been trying? What is the ovarian reserve of the patient? Suppose a patient has come to me at 37 years of age with an image of 1 nanogram, with antral follicle count of 4 to 5 or 6 to 7. So I will not waste her time going for IUI and then going for IVF. I will advise her to go for IVF directly. But if same profile and the patient is coming at an age of 26 or 27, trying for 2 to 3 years, never had undergone any IUI before, having an image of 2.5 nanogram, I will advise her to go for IUI first. But before that, I have to check some things. What are these things? I have to check the ultrasound of the patient. What are the antral follicle counts? What is the status of the endometrium? What is the status of the uterus? What are the status of the tubes? Because the tubes are playing a major role in IUI. The fertilization is taking place inside the tubes in IUI. So I have to check the patency of the tubes also. For the patency of the tubes, I will advise the patient hysterosalpingography. What we do in this test is done under ultrasound guidance. It is advised mostly in the menses day 5 to 7. After the menses are over, we advise the patient to do this test, and this test is done under X-ray guidance. The dye is instilled below the uterine cavity from below, and the tubes are checked for the patency. If both the tubes are patent, we see the dye is spilled from both the ends of the tubes. So if both the tubes are patent and all the conditions are looking favorable to me, now I will see the what are the factors present in the male. I will, at the first visit only, I will advise semen analysis in the male partner. And in the semen analysis, there are certain things which I have to check. According to the WHO 2022 criteria, we have certain parameters by which we have to do our semen analysis. So what are these factors? Volume, sperm concentration per ml, total sperms in the ejaculate, progressive motility, non-progressive motility. What are the non-motile sperms? What is the vitality? What is the pH? What is the liquefaction? There are many factors. So for IUI to be initiated, first of all, we have to check the concentration of the sperms. What are the concentrations? Suppose it depends upon the consultants. Some consultants do the IUI at the count of 15 million per ml. They take a cutoff of 15 million. I personally take a cutoff of 10 to 12 million per ml. If the count is less than 10, I do not advise IUI to any couple. I directly advise them IVF. But if the count is more,
just
yes,
sorry to interrupt you, Dr. Rashmi, because you were just mentioning about the semen analysis report. So could you please elaborate it, क्योंकि बहुत सारे हमारे members ऐसे हैं जिनके लिए ये जानना बहुत जरूरी है कि ये एग्जैक्ट कटआउट एक्चुअल में होता क्या है.
जी. देखिए, ये क्या है कि दिस semen analysis is basically what we do. We take the semen of the patient after an abstinence of 2 to 5 days, and then we collect the semen in a sterile container, and in our andrology lab, the sample is analyzed thoroughly. There are certain parameters which we have to check in every semen sample. This sample is checked according to the WHO 2022 criteria. What this criteria says, there are certain minimum cutoffs for all the factors. Like for volume, the minimum volume is 1.5 ml. The count is 16 million per ml. The minimum count should be 16 million per ml. Then the total count in the ejaculate should be more than 39 million per ejaculate. Then the progressive motility should be more than 32%. And the vitality should be more than 54%. The normal forms means the morphology of the sperms, how the sperm looks like. Does it look normal or it looks abnormal? There are certain parameters to assess, like the head piece, mid piece, then the tail of the sperm. The andrologist sees all the factors, and then they decide which sperm is looking perfectly normal. Because for the fertilization to take place normally, the sperm should look morphologically normal, and the morphology of the sperm is judged according to the strict criteria. They take the 4% cutoff. Like in 100 sperms, 4 sperm should look exactly normal. These are the certain criteria by which we judge the semen sample. But to be honest, this is not the sole criteria by which we can say that this this couple is fertile or this couple is not fertile. Because if the count is less than 16 also, the couple can get pregnant naturally. So this is not the only criteria to separate fertile from infertile couple. Just because this criteria was made according to the study done in 7 countries, continents, and the patients, they saw that the 95% of the patients which conceived in the first attempt, the criteria was above this. So the 5% of the patients, they had criteria below this. So this is not the sole criteria. This is just our judgmental. Like we can judge the patients, like if it is below this, then they will have a problem in conceiving. And
Right.
this also helps us to decide the treatment of the patient. Suppose the rapid progressive motility is less, it's very less, I will not advise IUI for this patient, because for IUI I want a sperm with a good motility. If the motility is very poor, how can the sperm function inside the uterus? Because
Right.
IUI is similar to a normal fertilization. If the motility is poor, if the morphology is poor, there are very less chances for a IUI to be successful in that couple. So this semen analysis report has a very important contribution in deciding the treatment of the patient, whether to go for IVF directly or to go for IUI first and then IUI and then IVF. Sorry,
Right.
because in IVF also we have many things, many advanced technologies by which we can select high quality sperm, normal morphology sperm for the ICSI purposes. So, but
Right.
this we can't do in IUI, because IUI is a natural process, natural fertilization. We can't
I
intervene
know.
inside the uterus. The sperm has to function on its own. It has to break the zona pellucida wall of the oocyte. It has to go inside. It has to fertilize. So if the function of the sperm is not good, if the sperm is functionally compromised, it can't function. So this kind of couples, they do not conceive in a good amount in IUI cycle. So we don't want to waste their time in IUI and then go for IVF, because in IVF now we can have many good technologies. We are having a good technology by which we can make these couples get pregnant with their own gametes.
Right.
So this makes us decide what we want, what the couple wants. Actually, see, what we decide, it depends on the decision of the couple also. Some couples, they don't want to go for IUI first and then go for
Right.
IVF. Some couples, they want to go for IVF directly. But both have their different indications. If the couple is young, married for a short time, and trying continuously living with her husband like for 2 to 3 years, and having a patent tubes, the semen analysis is average, I will go for IUI first. I will give her IUI cycle, a good IUI cycle. A good IUI cycle means a proper stimulation, a proper induction with 1 or 2 follicles. My target is only 1 or 2 follicles. I don't want to hyperstimulate that patient. It can be with
Right.
oral drugs, it can be with gonadotropies, but it should be properly monitored with a proper scanning done. It should be timed properly. Like, I will inseminate at the time of this egg rupture. I have to time it, because IUI will not be successful if I am not timing my cycle. The proper
Right.
timing of insemination decides the success rate of IUI. That's why we see variable rates in different centers for IUI. Some centers have a good success rate, some centers have a average, and some have very bad success rate, because it
Right.
all depends on the timing. What are the prognostic factors in IUI? There are many factors which decide the prognosis in IUI, because it's not always that IUI cycles always fails. We do get a positive result, and we do get a positive result in some patients which are trying for 5 to 6 years continuously but not getting pregnant in a natural cycle. So IUI does wonder in some patient, and IUI is a very good assisted technology for those patients who have all the things, parameters in my hand. Like, I have seen all the things, but why that couple is not getting pregnant? There must be some problem in intercourse, or they are not timing it properly, or
Right.
there are some cervical factors, some hostile factors in cervix which are not allowing the sperm to enter it. So the IUI bypasses these factors.
So we
That's
can
why
say
IUI,
that. Hanji,
yeah.
please. So next time when you are selecting between IUI and IVF, it's really important to ask your doctor all the options, and plus it is really important to take care of each and everything that your doctor is mentioning. And
Yeah.
Dr. Rashmi, I think the best part of IUI is it's a kind of, we can say that natural medicated cycle. But again, as you mentioned, that proper monitoring is really important. So we can say that if you have no underlying conditions, or we can say that nil underlying conditions, but again natural conception is not happening, then don't hesitate to ask your doctor for IUI treatment. So Dr. Rashmi, one very important part over here is we have one query related to this double IUI. What exactly is this double IUI?
So see, I personally do not practice double IUI. I always do a single IUI, a properly timed, a properly planned IUI, and a single IUI. Double IUI means that we are doing IUI for 2 successive days. Like if I am seeing in an ultrasound that I have a dominant follicle, I am giving
Hmm.
HCG for rupture, and I am doing IUI tomorrow and day after tomorrow. That means I am not sure when that egg will rupture. That's why I'm doing a double
Right,
insemination. I'm
right,
doing tomorrow and day after tomorrow. So if I'm not sure that when the egg will rupture, and if it ruptures tomorrow, if it ruptures day after tomorrow, I am inseminating both the days. But I
right,
do not see any concept behind that, because if I am timing my cycle properly, if I am doing all the things properly, if I know that I am giving my, I have checked my serum patient's LH today. If the LH is not in a higher range, it means that normal surge is not there. I will give HCG to
right,
my patient if I am seeing a dominant follicle, and obviously the rupture will take place after 36 to 40 hours. It will not take before. After rupture, egg will survive for 12 hours or 24 hours. Suppose I take it 12 hours, because minimum time is 12 hours. It can diminish at 12 hours also. And the IUI sample, once I prepare a IUI sample, that sample works for 4 hours. The capacitation of the sperm start. If I delay by 4 hours, then the sample will automatically not work.
not
So I have,
right,
after preparing the sample, I have to inseminate within 4 hours, and that sample will work for 4 hours only. So if I am planning my cycle accordingly, like today I'm giving a HCG trigger, and I am confident that my LS surge has not started. The natural LS surge has not started. So patient my patient's egg will rupture after 36 to 40 hours. 40 hours. I will call my patient day after tomorrow at an interval of 36 hours. I will I will also call her husband. I will ask him to give her to give his sample, and I will do a scan of the patient. It's definite that in between 36 to 40 hours, I will get a ruptured follicle. If I'm getting a ruptured follicle, then I will do the insemination. This is a proper timed IUI. Then what's the role of double IUI? There are no studies which have proved till yet that double IUI has more pregnancy rates than single IUI, because double IUI
oh,
is like wasting the time, and it's like we are not sure about the timing. But if you are
not
properly
sure,
timing
right.
it, then single IUI is more than enough. It's more than enough for a success.
Right. And one more query. First of all, let me just tell Varanasi people that if you want any kind of suggestion from Dr. Rashmi, then please do visit her at Nova IVF. And UNS is the informative, or you can say that our partner in this session. I just forget to mention UNS name. Sorry for that. Dr. Rashmi, we have another query related to this. Ki if I have ectopic pregnancies history, then what should I choose, IUI or IVF?
Yes, that's a very important question, Punima ji, because history of ectopic pregnancy, if a patient is having, that makes a very critical situation for us, and a very difficult situation to decide about the further treatment. Because in ectopic pregnancy, what we see that the tubes have some deranged function. The
Right.
ciliary movement, what we see is in our tubes, is somehow deranged, which can't transport the embryo inside the uterus, because some malfunction is present in the tubes, which has led to the ectopic pregnancy, and the patient might have undergone a medical treatment or a surgical treatment for ectopic pregnancy. She might have undergone a salpingectomy, Definitely, because in majority of cases, ectopic pregnancy leads to a salpingectomy, or she might have received a medical treatment. But what happens is that if a patient has a ectopic pregnancy before, then there are very high chances of her to have ectopic pregnancy in the future also. So, if a patient has previous ectopic pregnancy, then I will counsel the patient personally that see, you had a previous ectopic pregnancy, and after a previous ectopic, it's very important to see whether she has is having both the tubes functioning or only one tube functioning. Like, if she had a salpingectomy in that ectopic pregnancy, she might be left with the single tube.
Right, right.
So we are, if we are having a patient with a single tube, or we are having a patient with a double tube, and we can counsel the patient that there are very high chances of you having ectopic pregnancy in the future also, because the ectopic pregnancy means that your tubes are not functioning normally, and we can counsel the patient and then decide whether to go for IUI or IVF directly, because in IUI there are again chances of ectopic pregnancy. If
Right.
the tubes are not functioning properly, then there are very good chances of a ectopic pregnancy. So in IVF we can bypass these things, and in previous ectopic pregnancy, in IVF there are chances of ectopic pregnancy are equal to a general population. It's not like that in IVF there are more chances of ectopic pregnancy. So we can directly counsel these patients about the chances of ectopic pregnancy with IUI and IVF, and then we can decide. Because if the patient is non-affording financially, because IVF usually costs more than IVF, sorry, IVF usually costs more than IUI. So if a patient is financially compromised and can't
Right.
afford for IVF, then we can go for IUI, but we will simultaneously counsel the patient that we are going for IUI, but the chances of ectopic are greater than the natural population, because you had a ectopic in the past. But if a couple is
Okay.
affording, I will counsel them to go for IVF, because in IVF the chances of ectopic are equal to a general population.
Right. So we can say that if you have history of ectopic pregnancies, then please don't waste your time, because obviously each and every parameter have time related issues, and we all
Yes.
know कि ओवरीज हमारी एज के साथ साथ उनकी भी एजिंग होती है.
जी.
डॉक्टर रश्मि, वन वेरी इंपॉर्टेंट क्वेश्चन वी हैव हियर इज रिलेटेड टू AMH. If
जी.
we have low AMH, then what to select, IUI or IVF?
Yes, that's also very important question, because see, low AMH will be counted with other parameters also. Like low AMH in what age women? What is the age of the woman? Suppose a woman is coming to me at the age of 27 with a low AMH and trying for 1 or 2 years. Patient is young, 26 years with a low AMH, trying for only 1 or 2 years with a normal semen parameter. Then
Okay.
in this couple, I will advise her a IUI followed by IVF. I will advise her to go for a IUI for one cycle to see, because there might be some reason for her not getting pregnant, because low AMH is not a reason for not getting pregnant. Low AMH patients can also get pregnant naturally. Low AMH means
Right,
does not
right.
mean that the patient can't get pregnant naturally. So I will see, if a patient is young, trying only for 1 or 2 years with a patent tubes, normal semen parameters, I will give her a ovulation induction with a IUI cycle. And if the same profile patient with the same AMH comes to me at the age of 37 to 38 years, trying for 1 or 2 years and a normal semen parameter, I will advise her to go for IVF, because she's has having advanced maternal age, she's trying for 1 or 2 years. Why to waste time going for IUI then going for IVF, because the chances of her getting is very low. I will advise her to go for IVF directly, rather than to go for IUI first then followed by IVF. And in a young patient also, I will advise her not to waste 3 cycles of IUI. I will advise her to go for one or maximum 2 cycles of IUI. If it fails, then I will take her for IVF,
Okay.
because she's
Next
having good
question.
stable.
Right. So that's my next question. That how many cycles of IUI? How to decide is there any deciding factor, or our age, our body parameters, AMH है सब कुछ इनको मिला के क्या decide होता है? Because Dr. Rashmi, I have seen cases where people are just mentioning that I have 7 IUI cycles. Even I have heard about 8 IUI cycles also. So ये कितना justify है, और अगर इतना है तो क्यों है? Because on this platform we really want to aware our public कि कहीं ना कहीं आपका treatment राइट डायरेक्शन में जाना चाहिए, अगर नहीं है तो आपको वो अवेयरनेस होना चाहिए. सो हाउ मेनी साइकिल्स ऑफ IUI, एंड व्हाट आर द डिसाइडिंग क्राइटेरिया और डिसाइडिंग फैक्टर्स फॉर डिसाइडिंग द नंबर ऑफ IUI one should go?
Yes. See, I personally do not advise any couple to go for more than 3 cycles of IUI. If the couple
Mhm.
has undergone 3 cycles of IUI and all the 3 cycles are failed, then I will advise that couple to go for IVF directly. The 7 or 8 cycles of IUI are not justified at all. Why to
Right.
waste so much time in going for IUI again and again when IUI is not giving you result? 7 or 8 cycles of IUI means a complete year, because each cycle of IUI will take 1 month complete. Then if the couple is taking a gap of 1 month, then it will take 2 months. So 7 to 8 cycles means 1 to 1.5 year. So why to waste so much time going for IUI? It will give you financial burden also. It will waste your time. The AMH is decreasing anyhow. Your age is advancing. So I personally, in any patient, I do not advise more than 2 to 3 cycles of IUI.
Okay.
Then also I
And
will
Dr.
look at other factors also.
Hmm. हाँ जी, please continue. Dr. Rashmi, I think we lost your voice. There's some
Yeah,
network issue. Can you hear me, Dr. Rashmi?
yeah, I am hearing you.
ओके. हाँ, आपका थोड़ा सा लैग हो रहा है वॉइस में. हाँ जी, प्लीज कंटिन्यू.
Yeah, huh. Yeah. See, what I was saying, that I do not believe in doing more than 2 to 3 cycles of IUI for any patient. For any single couple. Hello, can you hear me?
डॉक्टर, हाँ जी, वी कैन हियर यू.
Can you hear me?
थोड़ा सा वीडियो आपका. यस यस. यस डॉक्टर रश्मि, प्लीज कंटिन्यू.
It's okay now or not?
ठीक है, परफेक्ट, प्लीज.
So I was saying that I do not go for more than 2 to 3 cycles of IUI in a. I do not go for more than 2 to 3 cycles of IUI in any couple. If the couple is not conceiving with 3 cycles of maximum 3 cycles of IUI, I advise them to go for IVF. And for me, looking at 7 to 8 cycles in a particular couple, it's like wasting the time, and it's not justified. 7 to 8 cycles of IUI doing in a couple without any success is not justified. It's like a financial burden for that couple also, because they are wasting so much money doing IUI continuously for 1 to 1.5 year, not getting result. It's mentally stressful for them also, and the AMH is decreasing anyhow. The AMH is not waiting for anyone. The egg reserve is diminishing, the AMH is decreasing, then the age is advancing, and the couple is also getting mentally stressed because IUI is not yielding the result. So the maximum cycles what I try in my patient is 3. In majority, after 2 we take a decision whether to go for IVF or not, and maximum what I do is 3 cycles of IUI. Beyond 3 cycles of IUI, if IUI has not given any result till now, I don't think that it will give the result in future also. So why not to go for IVF directly? When IVF is
Right.
having high chances of success than IUI. In IUI, if it's properly done in a very good center, the success rate is around 25%, 20 to 25%. In IVF, the success rate is around 70 to 75%. Then why not to go for IVF directly? Wasting rather than wasting time for IUI, because once the reserve is decreased and the age is advanced, then there are many complications coming up. So we have to decide
Right.
it, matlab, jaldi. We have to do jaldi.
Right. And one another important question, Dr. Rashmi, is do we really need to have a gap between two IUI or two IVF cycles? Usually people says कि कंटिन्यूअसली एक एक महीने में हमको आईयूआई नहीं कराना है. वी रियली नीड अ गैप बिटवीन टू आईयूआई साइकिल. सो व्हाट इज योर टेक ऑन दिस? डू वी रियली नीड टू गो अहेड विद दिस successive IUI, or our body need a rest for a month or so between two IUI cycles?
See, there is a no concept of rest in between the cycles, because it's like we are assisting a natural cycle. IUI is
Right.
the assisted form of reproduction. We are assisting the natural process. We are just, what we are doing, we are mildly stimulating the ovaries. We are not doing means progress, not very good stimulation. It's like we have to get only one or two follicles. We are not
Right.
giving many injections. We are not giving many drugs to this patient. So there's no role of waiting in between the two cycles. If a couple wants, they can go for successive IUIs, but it has to depend on couple also, whether they are mentally prepared for it or not. Suppose there is a cycle has failed, IUI cycle has failed, then the couple, it may be that the couple has a mental condition not to go for a second IUI in a successive cycle. They want to
Right.
take a break for 1 month, then it's okay, it's justified. Nothing will happen in 1 month. So it depends on the couple whether they want to go for successive or not, because successive IUI will be a similar to a
Natural process
IUI
only.
with a gap. It's not different, because in
Okay.
IUI there's no much stimulation, no much drugs given. It's like we have to prepare only one or two follicles for that patient.
Right.
So it can be a successive or it can be with a gap also. It depends on the couple.
Right. So next time, if your doctor is suggesting you to have successive IUI cycles, please see to your own comfort levels, because we know that whenever a cycle fails, there's a mental toll. So you need to think about it. क्या आप सच
Yes.
में mentally, physically afford कर सकते हैं next IUI cycle या नहीं? And if you really feel that you are drained out mentally, please do connect with us. We have very good counselors with us who can guide you properly through this journey. And Varanasi people, don't forget to visit Dr. Rashmi. Dr. Rashmi, last question, that what about this IVF cycles? We know that when we have low AMH or we have poor ovarian reserve, then doctors usually decides on embryo pooling. So when we are opting for this embryo pooling, do we really need to have that gap in between the stimulations, or हर एक cycle में हम stimulation पे जा सकते हैं?
Yes, embryo pooling is generally advised in low reserve patients, those who are poor responders, and we are expecting a very low count of eggs and embryos. So, in embryo pooling, generally we do not give a gap. In embryo pooling, we generally do embryo pooling in successive cycles. So,
Okay.
gap is generally not required for embryo pooling.
Okay. So because we have many queries related to this, I think nowadays we are more focusing about poor ovarian reserve, low AMH cases. That's
Yes.
why people are more concerned about embryo pooling. So Dr. Rashmi, your personal take on this embryo pooling process. Do you think it's really
Yes.
necessary, or it's a successful process?
See, it all depends on the patient and the doctor profile. Embryo pooling is not always required. It's not always required. What? Because if a patient is having a low AMH and we have a antral follicle count of 4 to 5 or 6, so if we are stimulating a patient very nicely with a proper monitoring, with a good quality drugs, with a programmed cycle, what we say, it's a individualized patient treatment. If I am seeing a patient profile with a low reserve, with a low count, I can give her adjuvants, I can add on some injections, I can give her LH support, which can make make the ovaries more stimulation, the stimulation will be more proper, and it will stimulate more antral follicles to grow. So I can expect, if I'm expecting 5 to 6 eggs there, then if my lab conditions are good, I can expect one or two blasts of good quality. And for a normal pregnancy to happen, even a single blast, single day 5 embryo of a good quality is enough. So I
Right.
personally do not believe in embryo pooling. I usually advise patient for a single cycle, because if I'm doing a proper stimulation, a good quality stimulation with a proper monitoring, I expect that if the patient is having a antral follicle of 6 to 7, I can get 6 to 7 eggs, and then at least 1 or 2 embryos in my lab. So if I am
Right.
transferring a single embryo transfer of a good quality day 5, then there are 70 to 75% chances that the patient will get pregnant. So I generally believe in a single cycle. I do not believe in embryo pooling, because embryo
Right.
pooling also adds financial burden to the patient.
Right. And I think the protocol with individual, each individual is treated as an individual. So protocol is different from each and every
Yes.
patient. And again, your doctor is the best person to advise you or guide you properly through the sessions. So viewers, if ever you are thinking of having this fertility journey, or you are thinking of selecting the right doctor in your city, just let us know. We will definitely connect you with the right doctor at right time at your city. And if you are in Varanasi or nearby Varanasi, then please do visit Dr. Rashmi. And again, we are emphasizing on this, please do watch this session again, because you really need to decide what next, IUI or IVF. And thank you, Dr. Rashmi, for joining today, and thank you, UNS, for having us as your informative partner for this session. Thank you, viewers, for joining. Dr. Rashmi, can you hear me? I think there's some network issues with Dr. Rashmi. Thank you, Dr. Rashmi, once again for joining us, and thank you, viewers. Thank you.